Cancer is increasing at an alarming rate, affecting more people than ever before. The question is, would you recognize the warning signs if your body was trying to tell you something? Every year, millions are diagnosed with cancer, and the numbers keep climbing. Many types, like pancreatic or brain cancer, remain silent until it's too late. But here's the truth: early detection can mean the difference between life and death. Spotting the signs before cancer advances can dramatically increase your chances of successful treatment. Now, I know what you might be thinking: every little symptom sounds like cancer when I look it up online. That's exactly why this video is different. We cut through the fear and misinformation to bring you real, science-backed warning signs that have helped thousands catch cancer early, when it's most treatable. Your health is too important to ignore. Sign number 15, persistent fever. A fever that keeps coming back or won't go away could be a warning sign of blood cancer. Unlike regular fevers that resolve within a few days, cancer-related fevers follow distinct patterns and often come with other symptoms. Leukemia and lymphoma can trigger your immune system to release chemicals called cytokines, leading to frequent, unexplained fevers. These fevers may occur without any obvious infection and are often accompanied by night sweats and unexplained weight loss. A pattern of temperature spikes at regular intervals, known as cyclic fever, is another red flag. If a fever lasts longer than 2 weeks or keeps returning without a clear cause, it's time to see a doctor. Blood cancers can weaken your immune system, making you more vulnerable to infections while also directly causing fever. A simple blood test can check for abnormal cell counts and other disease markers. Sign number 14. Jaundice. Have you noticed the yellow tint in your skin or eyes? Jaundice, which occurs when bilirubin builds up in the body, can be a warning sign of pancreatic or liver cancer. In pancreatic cancer, a tumor can block the bile duct, preventing bilirubin from being properly processed and expelled. This causes bile to enter the bloodstream, turning your skin and the whites of your eyes yellow. Initially, the yellowing may be subtle, but it becomes more noticeable as the condition worsens. Since the pancreas is located deep in the abdomen, pancreatic cancer can be difficult to detect early. Recognizing jaundice, especially if it's paired with upper abdominal pain, dark urine, or light-colored stools, is crucial in detecting the disease. Sign number 13. Unexplained or persistent pain. Is there lingering pain in your body that you can't explain? Pain that doesn't have an obvious cause, doesn't go away, and doesn't respond to usual treatments should be taken seriously. Pain is your body's way of signaling that something is wrong. Persistent pain could indicate cancer, especially if it doesn't improve with medication or rest. Abdominal pain could be a sign of prostate, bladder, testicular, or penile cancer in men. For women, unusual pain or sensitivity in the breasts may signal breast cancer. A heavy, swollen feeling in the scrotum might point to testicular cancer. Ongoing abdominal discomfort could indicate liver or pancreatic cancer. If the pain persists or worsens, it's essential to get it checked by a healthcare provider to rule out serious conditions. Sign number 12. Fingernail marks. Subungual melanoma, a type of skin cancer that develops under the nails, often starts as an innocent-looking dark streak. Medically known as melanonychia striata, this vertical line requires careful monitoring. Unlike normal nail pigmentation, cancerous streaks tend to appear suddenly and continue evolving. The most common locations for subungual melanoma are the thumb or big toe, but it can develop on any nail. The danger lies in how easily it can be mistaken for a simple nail injury or fungal infection. Key warning signs include a dark streak wider than 3 mm, multiple colors within the streak, and blurred or irregular borders. One critical indicator is Hutchinson's sign, where the pigmentation extends beyond the nail onto the surrounding skin. If you notice nail discoloration along with pain, nail splitting, or bleeding, don't delay, seek medical attention immediately. Recognizing these symptoms early can be life-saving. Sign number 11, bone pain. One of the most overlooked signs of cancer is persistent bone pain. Unlike pain from exercise or minor injuries, cancer-related bone pain worsens over time and is often more intense at night. When cancer originates in or spreads to the bones, it disrupts healthy bone tissue, causing a deep, penetrating ache. Osteosarcoma, primary bone cancer, commonly affects long bones in the arms and legs. At first, the pain might feel like a mild sprain or muscle ache, but gradually becomes severe and constant. Symptoms to watch for include a throbbing or aching pain that doesn't improve with regular painkillers, swelling or tenderness around the affected bone, and unexplained fractures, weakened bones breaking easily. If you experience persistent, worsening bone pain, it's crucial to get checked immediately. Early detection significantly improves survival rates. Sign number 10. Eye pain. Your eyes can reveal important clues about your overall health, including possible signs of cancer. Ocular melanoma, though rare, is the most common primary eye cancer in adults. The symptoms may start subtly but can progress into more noticeable changes. Potential warning signs include blurred vision that doesn't improve with new glasses, flashes of light, not caused by migraines, and a dark spot on the iris that grows or changes color. Those with lighter eye colors or fair skin are at higher risk. Regular eye exams become especially important if you have a family history of eye cancer or prolonged sun exposure. If you experience persistent eye pain, vision changes, or dark spots in your eye, seek medical attention immediately. Early intervention can save both your vision and your life. Sign number 9, excessive bruising. Have you noticed unexplained bruises appearing out of nowhere? Bruising that occurs without a clear injury, especially in unusual places like the arms, legs, or torso, could be a sign of blood cancer, such as leukemia. Leukemia affects the body's ability to produce healthy blood cells, leading to abnormal bleeding and bruising. Warning signs include frequent bruising in unexpected areas, nosebleeds or bleeding gums, and tiny red spots on the skin, petechiae. If you notice frequent or excessive bruising, especially in places where you don't usually get bruises, consult a doctor. Early diagnosis of leukemia can greatly improve treatment outcomes. Sign number 8, persistent cough or hoarseness. A persistent cough or hoarseness that lasts more than 2 weeks should be checked by a doctor. A lingering, dry, hacking cough that doesn't improve could be an early sign of lung cancer. Red flags include coughing up blood or bloody mucus, hoarseness or a raspy voice that doesn't go away, and chest pain that worsens with deep breaths or laughing. If you've had a stubborn cough that won't go away, especially if you're coughing up blood, don't ignore it. Early detection is key to treating lung cancer successfully. Sign number 7, blood in the urine or stool. Noticing blood where it shouldn't be is always concerning. Blood in your urine or stool should never be ignored. Blood in stool can appear as black, tar-like, or red, and blood in the urine can be pink, red, or dark brown. These symptoms could point to serious health conditions, including cancer. Blood in the stool may signal digestive cancers, such as colon or rectal cancer, or conditions like inflammatory bowel disease or ulcerative colitis. Blood in urine could indicate prostate or bladder cancer, or infections and other urinary issues. If you notice blood in your urine or stool, Don't wait, seek medical help promptly for evaluation and treatment. Early detection is key, and your health should never be taken for granted. Sign number 6. Mouth sores that won't heal. If you've had a mouth sore that doesn't heal within a couple of weeks, it could be a sign of oral cancer. Sores or white patches on your lips, tongue, gums, or other parts of the mouth should be checked out. People who use tobacco or drink heavily are at higher risk. Persistent mouth sores, especially when accompanied by difficulty swallowing or unexplained weight loss, need attention. Leukoplakia, white patches in the mouth, is a precancerous condition that can develop into oral cancer if untreated. Don't ignore these sores. Oral cancer can be aggressive, but early detection greatly improves treatment outcomes. Sign number 5. Persistent heartburn. Chronic heartburn, also known as gastroesophageal reflux disease, GERD, might seem like a minor inconvenience, but if it doesn't improve with lifestyle changes and medication, it could signal something more serious. Persistent acid reflux can damage the esophagus over time, potentially leading to esophageal cancer. This condition can cause Barrett's esophagus, which is a precancerous change in the lining of the esophagus, raising the risk of developing cancer. If you've been treating heartburn with over-the-counter medications for more than 3 weeks without relief, consult a doctor. Watch for other signs like difficulty swallowing or unexplained weight loss. Sign number 4. Changes in urinary or bowel habits. If you've noticed changes in your bathroom habits, it could be a red flag. Constipation or diarrhea lasting for several weeks can signal serious conditions, including cancer. Changes in bowel habits could indicate inflammatory bowel disease like Crohn's disease, or colon or stomach cancer. Similarly, changes in urination, such as pain, increased frequency, or a weak stream, could be signs of prostate or bladder cancer, or a urinary tract infection. If you notice any of these symptoms, it's essential to get checked. While they might be caused by less serious conditions, they could also be early warning signs of cancer. Sign number 3. Body rash. A rash that won't go away can be a sign of leukemia, a cancer affecting the blood and bone marrow. Leukemia can manifest through distinctive skin symptoms, like petechiae, which are tiny, round spots that appear on the skin due to platelet deficiency. These spots don't fade when you press on them and can be red, purple, or brown. Unlike common rashes that fade or itch, these rashes persist and may be accompanied by other symptoms like unexplained bruising or bleeding. If you notice these signs, it's crucial to get medical help right away. Sign number 2. Persistent headaches. A headache that doesn't go away, even with medication, should be investigated. Persistent headaches lasting more than 2 weeks could indicate a brain tumor or other neurological condition. If accompanied by symptoms like blurred or double vision, changes in hearing, or facial drooping, seek medical attention immediately. These symptoms could be caused by a brain tumor pressing on nerves, and early detection can lead to better outcomes. While not all headaches are related to cancer, those that persist and don't respond to treatment should be thoroughly evaluated. Sign number 1. Persistent fatigue. Unexplained, persistent fatigue could be an early sign of cancer. This type of tiredness isn't like regular exhaustion, it's a deep, unrelenting exhaustion that doesn't go away with rest. Leukemia or lymphoma can cause this fatigue, as they affect the blood and bone marrow, reducing your body's ability to produce healthy blood cells. Persistent fatigue can also be linked to cancers affecting hormone levels or causing internal bleeding, such as colon or stomach cancer. If you're constantly tired for no apparent reason, it's important to see a doctor. Persistent fatigue is often mistaken for stress or overwork, but if it lasts for an extended period, It should not be ignored.